Hello and welcome to the Mental Health Awareness video series. My name is Dr. Lynette Hillsberg and I am a counsellor. The subject of mental health is rarely discussed. Knowing what can control or change our mental health is important. We need to understand why we feel different and how the choices in our lives can affect our overall mental state. These videos are aimed to help open the conversation to bring awareness of this sensitive topic and encourage people to reach out for support if needed. The information will benefit the deaf, hard of hearing, vision impaired and hearing communities because the information is given in sign, voice and closed captions. As Auslan is my second language and out of respect to the community, I feel it's important that I have a deaf person sign on my behalf while I do voiceover. I would like to introduce James as the interviewer and Trisha as my deaf person who have agreed to help me raise awareness around this sensitive topic. I'd also like to acknowledge the traditional custodians of this land and pay our respects to the elders past, present and future, for they hold the memories, traditions, culture and hopes of Aboriginal Australia.
Hello and welcome. Today we are talking about people who hear voices. Often these people are assessed by a doctor or mental health practitioner and diagnosed with schizophrenia. With me today, I have Dr. Lynette Hillsberg, who will explain what this means. Welcome, Lynette, and thanks for chatting.
Thanks, James. It's a pleasure to be here.
So, tell me briefly, what is schizophrenia?
It's a general term given to describe a large group of mental disorders that are characterised by intellectual deterioration in person who previously had none.
So what happens to the person?
Well, the level of mental capacity and functioning decreases because they have a change in thought patterns that's different to other people. They have difficulties with concentration, perception, thinking, memory, and it's really important to know that it's very distressing for them.
How do you mean different to others? Can you give some examples?
Okay, so their reality changes. They may start to experience hearing voices, having delusions, have difficulty in speech or expressing themselves, inappropriate emotions or facial expressions, disturbed sense of self, and tend to withdraw from the external world.
So what does the word schizophrenia mean?
Well, it literally means split personality, referring to the portions of the psyche.
So does a person have multiple personalities? And how was it discovered?
No, it doesn't mean multiple personality disorder. This is where the person has distinct, separate and alternative personalities. The term schizophrenia, first described in the 1800s by Dr. Emil Kraepelin, and used the Latin term dementia praecox. Then in the early 1900s, a Dr. Eugen Bleuler renamed it schizophrenia. It's then been reclassified by Dr. Kurt Schneider with more specific information, including first and second rank symptoms.
So what are these symptoms?
Well, the first rank symptoms includes psychotic delusions and hallucinations, which is where you're hearing voices and you think that someone's watching you, your house, a bit suspicious, you might hear things that aren't there. Second rank symptoms include all the other experiences and behaviours associated with the disorder.
I see. So what happens when someone has this?
Okay, so the clinical picture of someone who suffers from this is complex. It differs from one another and experiences may be different from episode to episode.
So How would I know if a person is having this experience? How would they behave?
The changes in behaviour are subtle at first, but then the changes in thought and behaviour are disruptive and bizarre, and they can't be ignored. And these include episodes of staying up all night, incoherent conversations, aggressive acts, and these are confusing and frightening to the person or family or friends around them.
And what sort of symptoms would the person have?
Include hearing voices or seeing odd things, tactile or olfactory hallucinations, and that can be really intense. They hear voices or get specific messages from inanimate objects like the fridge, computer, TV, billboards or radio, and there's often an increase in paranoia that the person may believe these voices are secretly watching them from cameras in the ceiling or hidden in the furniture. A lack of insight or judgment and can make poor decisions in their life.
I've heard the term psychosis. Is this what the person has?
A psychosis is an umbrella term that's used to describe a group of conditions where people have unusual experiences not in keeping with other people's experiences. They're not in touch with reality, and these types of experiences can be hallucinations.
And is this the same as a delusion?
No, psychosis is different from a delusion. It's a very fixed belief that's held despite evidence to the contrary. So this is where the person becomes really focused on their behaviour changes. They believe so very strongly that these beliefs are true. And there's two types of delusions.
Do you have examples of these?
Yep, the non-bizarre delusions. And these happen around themes of jealousy or persecution and originate from real-life experiences. An example would be a recently separated woman believing her husband has tried to poison her, or a man believes that the members of a drug gang are trying to kill him because when he was in school, he reported to the principal that several classmates were selling drugs at school.
Oh, interesting. And what is the text type?
That next category is bizarre delusions. And these are implausible and not understandable or not derived from any ordinary life event. So if the person experiences loss of control, believing that some outside force is controlling their thoughts, and this could be thought broadcasting, others can read or hear their thoughts. Thought insertions, where someone's placed thoughts into their mind, and thought withdrawal is where someone's removing thoughts from their head. A classic example of this is a person's convinced that a computer chip is put inside them when they have an injection, and it influences their movements and their thoughts.
When someone presents with hearing voices, does that always lead to a diagnosis of schizophrenia?
It's true, some people have psychosis, hear voices, but not everyone who hears voices will have a psychotic illness or be given a diagnosis of schizophrenia. For some people, hearing voices just doesn't trouble or upset them, and they find they're quite happy to live with them. The diagnosis happens when these experiences and voices becomes distressing.
So how common is it?
Yeah, research is around 10 to 25% of us will experience it at some point in our lives.
Okay, so how can I catch this, or how does it start?
Cause of schizophrenia is actually not fully understood. Contributing factors could be four main things. And you've got brain chemistry, which is the abnormal functioning of neurotransmitters such as dopamine. If a parent has this, then the children are susceptible to the disease. That's hereditary. Abnormality in the brain, complications during pregnancy and birth from a brain injury or infection.
Right. So what about triggers?
Triggers can be from childhood trauma, genetics, other mental health diagnoses like depression or bipolar. PTSD, and there's triggers will spark or trigger an episode leading to the person hearing voices. Diagnosis needs to be made by a qualified medical practitioner or GP, and it can take a number of months for this to happen. Symptoms can change depending on the medication and social situations as well.
So, is the person aware they have a mental illness?
Schizophrenia is a disorder of thoughts, so perceptions and behaviour sometimes isn't recognised as an illness by the person experiencing these symptoms. They don't believe they have a mental illness, and this poses such a problem for the family and friends because in reality they only agree to treatment to please their family or their doctors.
Okay, after hearing all of this information, I have a bit of a weird question. If this happened to me, how would I experience it as I'm deaf and can't hear?
That's a great question. If you've never heard a voice or communicated with sound, you'd still have an inner voice or some kind of structured language that you think in. You see, you think in whatever way you communicate. Most people, this would be speech as the main method of communication, but you also think in pictures and images. You don't need sound to think. A lot of people are visual spatial learners and think in sign languages or images, and they describe it as seeing two hands signing in their head. Sometimes it's accompanied by a mouth if they use lip reading a lot. Well, I know when I'm asleep, I often use sign language to communicate to others in my dreams.
That's so interesting.
Yeah, I know.
So, let me ask about treatment.
Okay, so there's 3 types of treatment, and this is a brief overview. Initial treatment uses medication, and that's to help alleviate symptoms. It's antipsychotic medication, antidepressant, and anti-anxiety medication. It decreases the risk of suicide, normalises sleep patterns, and reduces illicit drug-taking behaviour. Should always be done with counselling therapy. The next is not drug therapy, but has CBT or cognitive behavioural therapy, and that targets the stresses in life that makes their voices worse. This improves the relationship they have with their voices, and it's about restoring the power balance. Allows more assertive and compassionate communication. Third type works on the cause where the trauma is the basis of their voice hearing experiences and reduces some of the really distressing content and memories, like for example PTSD symptoms that comes from this.
So, is there anything else that may help?
Yeah, supports. Having a good support network, family, friends, psychologists, psychiatrists. It's important to be you feel comfortable with, who will try and understand your situation. Also linking in with help networks, as most people push the voices away. They find them frightening and derogatory.
Is there a main support network available?
Yep, there's the Hearing Voices movement or network. The aim is to support people with lived experience, promote the running of self-help groups for people who are hearing voices. And they've been very successful in promoting a view that hearing voices is very complex, significant and meaningful, and that should be explored rather than dismissed.
Well, thank you, Lynette, for a most informative chat. That's all we have time for today. Thank you for being here.
You're welcome, James. I look forward to chatting to you again.